Hi, everybody. It's Dr. Hillary Fredrickson. What's going on? I think Dr. Kara's is busy with patients today, so I'm just going to get going. Today, I'm going to talk to you a little bit about essential oils. I've got some patients that are sick and either with COVID or with flu, and there's a lot of congestion and chest congestion going on around. So I want to kind of talk a little bit about using essential oils for good as you're sick in the kind of, I call this like the shoulder season, right? Like it's transitioning from winter to spring, and there can be a lot of crud, especially in California. A lot of things are blooming, so some people get allergies on top of getting a virus. It's good times. But so essential oils are a really powerful tool to deliver medicine into our sinuses, our bronchi, and these medicines are pretty actively antimicrobial, antiviral, antibacterial. Okay, so when we were at naturopathic medical school in Seattle at Bastyr University, which we loved, well, it was hard as shit, but we loved it. But anyway, so we had in our microbiology class, we were growing lots of different bacteria, Haemophilus influenza, staph, strep, and we were doing experiments on antibiotics versus essential oils, and using both, waiting a day or a couple hours and seeing kind of the destruction of the colony and which medicine was more potent. So obviously antibiotics have their role in sicknesses or secondary infections, but when we get into the virus realm where we're either having the flu or a cold that then goes into an ear infection or a sinus infection, antibiotics really aren't appropriate in the early stages of treatment in any way. And we are really trying to save antibiotics, obviously, in our greater community for when people need them and to reduce antibiotic resistance. And so in pediatrics, in adult medicine, we're really trying to work through some of these things in the early days without using antibiotics, and antibiotics are saved for true bacterial infections that can't seem to turn the corner, that the immune system can't break down. Okay, so and if you are watching live and have any questions, I'm looking in the chat, so you can feel free to ask me questions or communicate with me in that way, just so you know. So one of the things that the essential oils do is they help to penetrate, they get into the sinus tissue here, into the throat, into the upper bronchi, like I said, and have an antiviral / antibacterial function. And you all know, if you've watched me before, that I'm a big fan of using nasal sprays. I think I've got one right here in my work bag. So I have the nasal sprays with me all the time in the winter traveling. I've heard from several of you that, I guess maybe I left it at my office. So here it is. That using nasal sprays is one of the ways that you can prevent something if you're exposed to a party and people are sick, you're on a plane, you're doing anything. This is my favorite nasal spray. It's called Xlear, and it's got xylitol and some grapefruit seed extract. And there's research that shows that it stops the viruses from sticking and replicating, because what's happening is you're inhaling something, it's coming into here, it's replicating and getting momentum and power to kind of take over. And then the immune system comes and starts to make a mess of things, right? Starts to pitch a fever, starts to try to fight. And there's a lot of inflammatory process and creates mucus and a lot of different things. So we're fighting not only the critter, but we're also just trying to support the immune system a little bit. Essential oils are one of the tools once you are sick that you can use. And one of my favorite ways to use essential oils is with the steam inhalation. This is this is called Stress Less, and this is not really necessarily for what I'm talking about, but you can get any. My favorite winter essential oils to have on hand are oregano oil, thyme oil. Thyme oil's really, really strong. And eucalyptus can be really great. So, or some kind of a sinus blend. A lot of times they're blended. Some of them there's lemon, eucalyptus, but those, if you have one of those, oregano, thyme, or eucalyptus, you're going to, tea tree can work for some people, but those top three are my three like antimicrobial for the winter. And these essential oils are very strong. So you just have to know more is not better. I learned it the hard way in school when I was a novice naturopathic doctor. My poor family, everything was experimented on my husband at the time or me, and I didn't know what I was doing. So of course I'm a more is better person. I'm using thyme oil. I had a cold and I'm going to do a steam inhalation, 10 drops of thyme oil, boil hot water, towel over, eyes wide open. I burned the absolute living hell out of the sclera of my eyes. They all turned red. The essential oils are really, really strong and need to be used in gentle amounts, especially if you're doing them with children. Okay. So these things you need to really recognize the potency and power of the medicine. And so my eyes were burned for about 3 days. And, I now shout it from the rooftops that you don't do that. Okay, I'm going to just run and actually I'll take you with me and show you a setup for a steam inhalation. It's really easy. So what you do is you get some kind of a bowl and a towel, and basically you get water. Remember that boiling water is going to burn you. So don't burn yourself. Steam is super hardcore. Steam is water at an extraordinarily high temperature, right? So you got to kind of like take the edge off of the steam, off of the boiling water. But what you do is you put a couple drops. I use 2 or 3. They're, again, super potent. I'm like queen of repeating myself, but I really want you to get it. And then you pour hot water. So even though like this blend isn't one of the oils that I talked about, like you can already sense that it's opening me up. Like it's just gets into the passages and it helps to open stuff up. So assuming this was like hot boiling water, it's not, but you pour it over, you kind of let the steam come up. You're going to smell the oil. It's going to be you're going to get a lot of it. You let the water like take the edge off the boiling of the water so you don't burn yourself, right? And then you take a towel, just a tea towel works great, and you create a little vent in steam like this so that the medicine's going into your sinuses. You can breathe in through your nose and you can even breathe in a little bit through your mouth. Now, if you have allergies to plants, like this is not going to be a good treatment for you, right? And you might even want to start with dabbing the essential oil on your skin so that you know that you're not having any weird reaction to it. Generally, patients do pretty well with it. So 2 drops of oregano oil, thyme oil, a few times a day, steaming, and all of a sudden now you've got a potent medicine in your passages that is starting to kind of fight off the virus and the bacteria. Sinuses are a really interesting thing. They're very hard to deliver medicine to because they're not well. The blood it's not, the perfusion into the sinus is challenging because it's kind of cavernous and cave-like. It doesn't get great blood flow. So we have to use fairly high doses and a strong antibiotic to get into these sinuses. And so doing a steam and just inhaling is such a beautiful natural way to get medicine into these places and spaces. Another way to use essential oils, if you don't want to do it like this, or if you have a baby, it's obviously not a great idea to use the steam inhalation with young babies. Okay. They can't, it's way too strong for them, too strong for their skin. So another great way to get some medicine like that into their passages to help break up the virus in their sinus that's replicating is in the shower. So you could put a couple drops at the bottom of the shower, the hot water hits it and you'll smell it. You're basically creating like a steam room in the shower. And that you can be holding the baby and just always start when you're with the baby, one drop. They just need small amounts. And they're breathing. Sometimes they'll be crying, getting some of the medicine in if they're not feeling well. That can be really helpful. Another way that you can work with the shower is like if you have the shower coming off the wall, the metal, you can put some essential oil on the metal part, and that the heat and the steam will do it that way if you want less contact on your feet. Okay, so it's a great way. Some people put a drop or two in a humidifier or in a room, an essential oil diffuser. If they're sick, that can also be really helpful. And remember that good old Vicks Vapor Rub. If you're in my generation, my mom used Vicks for everything when I had a chest cold, and I love Vicks, and Vicks is eucalyptus, right? So, I like natural products a little bit more, but they had it going on there. What they're doing is they're putting something that's opening up, bronchodilatating, and helping keep. My mom would wrap the sock around my neck and I would smell it, and it would help keep things open and keep things draining. So between your nasal sprays, again, really hard to do this with babies, but if you're an adult, you can nasal spray several times a day and do a couple steam inhalations. And all of a sudden now you are using antivirals and antibacterials to treat your virus where you don't, there's not a lot of early treatments for viruses, right? You go to your doctor and they're like, well, you've got a virus, just suck it up and you're fine. But there's a lot that you can do. I also really love heat and manual therapy. So doing getting any kind of, if you have a microwave in your home, filling up 2 dress socks with uncooked rice, putting them in the microwave for a minute or so and creating heat packs and putting a little heat here and really helping to move and manually move. The tissue can be also a very helpful way to shift things if you have a cold. Okay. So there's a lot of things to do when you have a virus, and obviously coming at it with some vitamin C, vitamin D, a lot. I love using N-acetylcysteine for stuffiness and for congestion. So there's a lot of other natural tools to use to help you with your sickness and your cold, flu, COVID, whatever it may be. But having some of these on hand is a really great way to start to build your at-home medicine cabinet and start treating kind of on the early side. Mwah. Much love to you. Have a great day.